The last video I want you to watch, this is Dr. Judy Mikovits, and I hope that I'm saying the name correctly. And she's a scientist that she worked with Dr. Fauci. Dr. Fauci, according to her, we got to put a link to all these videos. You can watch the full length interviews and everything. Apparently, she's exposing Dr. Fauci. Again, you have to do your own research. I don't know how much of it is true or not, but I'm just giving you information. Let's go ahead and watch the video, and then I'll tell you what I think, and then we'll take it from there.
If you yourself right now, God forbid you yourself got coronavirus, how are you going to treat yourself? You know, if you were, it's Dr. Judy, you go, you find out you have coronavirus, how would you cure yourself?
Well, that's easy. I already did it. Type 1 interferon. Type 1 interferon, a spray in my mouth. I'm preventing it. I'm not just, I told you, if I get it, I'm one of the ones who can get most severely ill because I have these other issues from the viruses they gave me. At any rate, I use a type 1 interferon spray, very, very low dose. That very thing I learned of March 31st, 1980, my very first job. It cost pennies to the dollar. I prevent with zinc. I would be getting a prescription for the hydroxychloroquine. I would be doing all the things that I always do, prevent that cytokine storm. Make sure I'm not eating GMO, Roundup, glyphosate, because that's depleting your oxygen, and we don't want to deplete our oxygen. I would stay off planes simply because of the oxidative stress over ozone layers. I would drink natural products, juices, which I carry with me should I have to travel, because I can have those things. So I would prevent the disease development even if I got the infection.
What do you say about folks? I heard a doctor the other day talk about zinc, and then he talked about quinine, and then he talked about tonic water. What do you have to say about that?
Well, quinine is the basis, the quinolones, the quinine, that's what hydroxychloroquine, the Plaquenil, these anti-malarial drugs were originally quinine based. So yeah, tonic water, quinine, I use liver bitters and things like that. So these are very valuable nutritional therapies. And again, I use a hot lemon water because it's breathing in the lemon, the vitamin C, you can kill in your nasal passages if you heat it up. I use eucalyptus on a vaporizer. So I just vaporize, open up my lungs. You know, we used to do this as kids. So just enable myself to breathe, support my immune system with, we know zinc has many antiviral properties, and with the hydroxychloroquine, it opens up the channels so the zinc can get in. And so you can use low dose zinc and things like that. You don't want to use high dose of anything. I don't necessarily ascribe to some of the things like intravenous, vitamin C, that can be quite toxic. And again, there's a whole landscape of whatever's going on. So just low dose nutritional therapies. I don't eat GMO. I eat healthy eggs. I keep myself out in the sunshine with natural vitamin D. I just prevent, and I will not wear a mask. No, because that'll suppress my own immune system. You're not made to breathe dirty air. I'm not coughing right now. So I do have childhood pleurisy, so I am susceptible. But I'm not caught. And pleurisy means fluid in the lungs. So I'm amplifying any coronavirus infection should I get infection, because it needs fluid to live, and it's that dry cough and things like that. But I'm not coughing, so I can't possibly spread the virus. These viruses live, when you say aerosolize, they live in water droplets. Dry air is not water droplets. Yes, if you cough or sneeze, a tiny little droplet containing virus can go. This is how we transmit things like influenza every year. But I certainly wouldn't get a vaccine of live flu viruses, which cause upper respiratory infections, and then put on a mask and amplify those live attenuated flu viruses and cripple my immune system that needs to respond to the infection. So I would simply strengthen my immune system, and again, we're preventing natural herd immunity by not letting the people who have recovered, who are immune, who are asymptomatic, they're not spreading virus. If you're asymptomatic, by definition, you're not coughing droplets of coronavirus on people. It's not how it works. And so we don't wear masks. We've never worn masks with the common cold and influenza. If I'm taking care of my husband, for example, who has COPD, every year I prevent him from getting any kind of microbial infection the same way. So I'm not treating, yes, I do keep him at home more. Yes, I do insist he take beach walks and stay outside and keep his immune system up and not eat so much crap and drink, we use tonic water. So we put tonic water with our lemon and we got a little quinine. You don't need much, and you don't need much for any of these. And he hasn't been sick. He got his COPD from a microbial infection when he was in his 30s. He's now 81 and he hasn't been sick in years. He's fine.
Okay, so this was the last video that you watched. Again, one of the most important things that we all have to remember, that in order for us to survive, in order for us to have a healthy life, we need to have a strong and healthy immune system. I've talked in my previous videos, I'm going to say it again. In order to help and make your immune system strong, you must eat right food. You have to sleep. You have to take right supplements. You have to be under the sun at least 15 minutes every day. And most importantly, educate yourself. With health education comes freedom. Let's go ahead and make our immune system strong. Remember, I said this and I'm going to say it again. We are about to lose our liberty and freedom. Wake up, do your research, and let's collectively do our own part so we can have a strong and healthy immune system, so we don't have to go through this nonsense situation that people are dying and losing their businesses. Thank you so much for watching this video. God bless America. God bless every family, every children. And I hope that you wake up, do your research, and find out what is the truth. Thank you.